Hi, welcome to all of you. I am your instructor, Dr. Junaid MD. Today, we are going to focus on anatomy of penis. It is an important external organ of the male reproductive system. We will go over its structure, functions, supporting tissues, blood supply, nerves, and also review some clinical conditions related to it. So, we will start from functions of the penis. Penis has, first of all, sexual function, which involves erection, ejaculation, and remission. So it is its reproductive function. During sexual arousal, blood fills the erectile tissues, causing an erection. Semen is then ejaculated through the urethra, followed by remission back to the flaccid state. Second function is the urinary function. The penis contains the urethra, which carries urine from bladder to the outside of the body. Structural divisions of the penis. The penis is divided into three main parts. The root is the deepest, anchored part, hidden in the perineum. The body is the visible shaft, suspended from the pubic symphysis. Finally, the glans forms the rounded tip, containing the external urethral opening. As you can see in this figure, there is body of the penis or shaft of the penis, and you can see the root of the penis, you can see glans of the penis and opening of the urethra. This picture is also showing the base of the penis, shaft of the penis, glans and foreskin of the penis. Erectile tissues. Penis contains the root, body and glans. Root contains bulb of corpus spongiosum plus two corpora cavernosa, right and left, and two body contains two corpora cavernosa, which is right and left, one corpus spongiosum. Root contains bulb plus two crura, and glans of penis causes expansion of the corpus spongiosum. As you can see in this figure, there is right crura, left crura, and the bulb in the center, which is corpus spongiosum. This green tissue is highlighting corpora cavernosa, right and left, and in the center there is bulb and corpus spongiosum. Muscles of the root. There are four key muscles at the root of the penis. The bulbospongiosus muscle helps to empty the urethra after urination or ejaculation, and they also boost erection by increasing pressure in the bulb. Second is the ischiocavernosus muscle, which compresses the crura, pushing blood into the corpora cavernosa to maintain the rigidity during erection. This picture is showing the bulbospongiosus muscle and ischiocavernosus muscle. Then what are the facial coverings of the penis? The penis has several facial layers. The external fascia is continuous with the abdominal fascia. Beneath it is buccal fascia, which binds the erectile tissues together. Deeper still, the tunica albuginea surrounds each erectile body and forms the septum between the corpora cavernosa. As you can see in this picture, there is a deep penile fascia, which is known as buccal fascia, and superficial penile fascia, which is known as Cole's fascia. Ligaments of the penis. The penis is supported by the two ligaments. The suspensory ligament connects the erectile bodies to the pubic symphysis, while the fundiform ligament forms a sling from the linea alba, also attaching to the pubic symphysis. Here you can see the suspensory ligament, which is connecting the erectile bodies to the pubic symphysis, and secondly you can see the fundiform ligament, which is forming a sling from the linea alba and also attaching to the pubic symphysis. Then skin of the penis is darker and more elastic than surrounding skin. At the glans, the prepuce or foreskin forms a double layer of skin and fascia attached by the frenulum. The space between glans and foreskin is called the prepudial sac. Here in this picture you can see the foreskin, that is prepuce, head, that is glans. Then we will look towards the blood supply of the penis. The penis is supplied by the branches of the internal pudendal artery, which gives the branches like dorsal, artery, deep artery and bulbourethral arteries. Venous drainage happens through the deep dorsal vein into the prostatic plexus and superficial dorsal veins which drain skin and superficial tissues. As you can see in this picture, there are branches of the internal pudendal arteries supplying the penis like cavernosal artery, bulbourethral artery, circumflex artery and dorsal artery. And picture below is showing the venous drainage of the penis, which happens through the deep dorsal vein into the prostatic plexus. Then we will look towards the nerve supply. Nerve supply comes mainly from the spinal segments S2 to S4. Sensory and sympathetic fibers travel through the dorsal nerve of the penis, a branch of the pudendal nerve. Parasympathetic cavernous nerves control the vascular changes responsible for the erection. Here in this picture you can see that spinal segments S2 to S4 giving sensory and sympathetic fibers traveling through the dorsal nerve of the penis. Parasympathetic cavernosal nerves can also be seen here. Clinical conditions. First of all, a clinical condition of prepuce. Two common preputial conditions are known. First one is phimosis, where foreskin cannot be retracted, and second one is paraphimosis, where a retracted foreskin becomes trapped behind the glans. Both can cause hygienic issues, infections, or even strangulation of the glans in severe cases. Like in this picture, you can see on the extreme right side, you can see the normal position of the foreskin and glans. Both are visible. In phimosis, you can see foreskin cannot be pulled back to expose the glans, and foreskin is over the glans. And in paraphimosis, foreskin cannot be pulled forward to cover the glans. Instead, it got stuck around the glans of the penis. It is called paraphimosis. Second, clinical conditions. Clinical condition include functional one, which includes erectile dysfunction, which can be of various causes like vascular, psychological, or mixed causes. And next one is priapism, which is prolonged painful erection which is not related to the sexual activity and lasting more than 4 hours. It is a medical emergency because it can cause permanent damage to the penile tissue. So these are the types, and in this picture you can see the phenomena of the normal erection on the right side of the picture, and on left side two types of the priapism are given, like low flow priapism and high flow priapism. And this picture is also explaining types of priapism, like ischemic priapism is also known as low flow priapism, which is most common, painful, rigid core, poor blood release. Non-ischemic type has high flow. It is less common, it is usually painless, and often it is trauma related. Third type is stuttering priapism, which is recurrent ischemic priapism. Recurring attacks of the pain occurs linked to the sickle cell disease, mostly seen in sickle cell disease, stuttering priapism. So in summary, the penis serves as both reproductive and urinary roles. It is supported by erectile tissues, muscles, fascia and ligaments supplied richly by the blood vessels and nerves. Understanding its anatomy helps to explain the conditions like phimosis, erectile dysfunction and priapism. Thank you very much for listening this lecture. For any query, you can contact me on my WhatsApp number. Until that time, take care. Bye bye.